Chair and members of the committee, thank you for the opportunity to testify today in support of Senate Bill 660. My name is Jeffrey Hallett, president of Hallett Consulting. I'm a Texan, a consultant, and a subject matter expert in active and passive vehicle barrier design and implementation. With over 35 years of experience in electronic security, 20 of those have been dedicated to perimeter security. I'm also a member of the ASTM F2656 and F3016 crash standard committees. And since 1985, the Department of State has recognized the need for vehicle barriers, crash barriers at critical government assets. In 2003, unlike the old DOS standard, which focused on a large 15,000-pound vehicle traveling at speeds from 30 to 50 miles an hour, ASTM took over these standards with broadening the test parameters to include a wider range of vehicle weights, sizes, and speeds. Senate Bill 660 focuses on protecting hospital rooms and hospital emergency rooms, places dedicated on saving lives. We've already heard that in the past decade, over 400 vehicle crashes have occurred at hospitals. Current statistics from the Storefront Safety Council show that nationwide buildings are struck by vehicles more than 100 times per day, totaling over 36,000 incidents per year, approximately 16,000 injuries and 2,400 deaths annually. The good news is these accidents are preventable. Tested, certified crash-rated bollards and barriers are already mandated for courthouses, Federal Reserve banks, airports, and other locations. Additionally, professional sports have followed suit, with the NFL and NBA implementing similar protections for their stadiums and arena. In 2020, Texas even took a proactive step in installing over 80 crash-rated bollards at the state capitol's pedestrian mall. These solutions are cost-effective, minimally disruptive, and proven to save lives. I support Senate Bill 660 and hope it only serves as a foundation for future legislation to protect more and broadening venues.
Thank you, Mr. Hallett. I know you were probably here when we laid it out with Senator West in 4 hours and 15 minutes. You're still here. I appreciate that.
Thank you.
If you would, state your name for the record, who you're with, and you may begin your testimony.
Madam Chair and members of the committee, I am Joelle McNew. I am a certified CPTED practitioner, U.S. CPTED Association Board Director, Texas Crime Prevention Association member, co-trainer for TCOL Crime Prevention and CPTED training. As the co-founder and president of Safe Horns, a nonprofit organization focused on safety on and around the University of Texas at Austin, I have dedicated my career to public safety and crime prevention. In addition, I'm the founder of Safeguard Strategy, a consulting firm specializing in crime prevention. Through this work, I've collaborated with organizations and institutions to implement effective design-based safety measures that enhance security and improve quality of life. I am here to express my strong support for Senate Bill 660. This measure aligns with crime prevention through environmental design, CPTED, principles, specifically the principle of natural access control. By strategically placing barriers such as bollards, we can effectively deter unauthorized vehicular access and enhance safety of patients, healthcare workers, and visitors. Passing this bill is a vital step in safeguarding our healthcare facilities and an opportunity to educate citizens about the broader benefits of CPTED. By incorporating CPTED principles into public policy, we can standardize crime prevention strategies across communities, foster safer environments, and improve all Texans' overall quality of life. Some standards include the ISO International Organization Standard 22341, the National Fire Protection Association NFPA Chapter 8, Section 730, the American Public Transportation Association ISRP 007-10 Rev 1. This legislation represents a significant step toward enhancing public safety and reflects a broader dedication to safeguarding individuals within our communities. I urge the committee to support Senate Bill 660 and help set a precedent for thoughtful design and crime prevention statewide.
Thank you. Thank you for waiting today. We appreciate your input. If you would state your name for the record, who you're with, and your position on the bill, and you may begin.
Good to see you, Madam Chair. Ware Wendell with Texas Watch. We are in strong support of the legislation. Thank you for the early hearing on the safety bill. We thank Senator West for filing it, and we commend Matt Grant and his investigative team for doing the digging here and figuring out just how big this problem is, not just in the state, but across the country. For over 25 years, our nonprofit has advocated for safety in our state. And I think it's important to understand here that folks who are heading to the hospital are not at their best. They're under stress. Obviously, if you're driving to the ER, that's under stressful circumstances. But if you're going in for a scheduled surgery, that's stressful as well. And so people aren't at their best, they're not driving at their best, and we need to protect all the folks inside of the hospital, whether it's doctors, nurses, healthcare workers, patients and their families. We need to protect them. This is a cost-effective way to do this. It's easy to do. I commend the hospitals who are out there doing it already. It shows that it can be done. And Senator Hall, I know you think a lot about this. There are people out there who intend to do us harm, bad actors. And if you think that they want to cause a mass casualty event and then drive a large vehicle into our emergency rooms, we would not be able to treat those victims. They could wreak havoc in our state. That's why it's important to secure these facilities. Our hospitals are critical infrastructure. My understanding is that this can be done for $15,000 to $20,000. And the gentleman sitting to my right is the national expert on that. So in terms of cost, it's not a lot.